if you've done a first aid course before or you've been treated by a first aider, one of the first things that they're going to do is put ice on the affected area. I'm always using the shoulder just because you can see my shoulder. But they're going to get that ice pack, they're going to put it on the shoulder, and what they say is that's going to reduce the pain, it's going to prevent inflammation. Don't worry if you've done loads of research and you're hearing people say that the rice rest ice compression elevation isn't a good tactic. Just remember that this is taught in first aid courses because it's a good tactic the moment that you get injured because you don't know what's happened. So when you want to treat an injury that's just happened, that's why they do it. If it's later on down the line, actually, you might want that inflammation to encourage recovery. So they're two very different things, but we're not going to be talking much about that today. We want to talk about the temperature aspect specifically. So when somebody puts an ice pack on your sore shoulder, what is going on there? Well, your spinal cord can take a certain amount of information up to your brain. The information of like tissue damage or threat or whatever, that is going to travel up the spinal cord when you get injured. But if you put something cold on, then now there's more information that needs to travel up. So the brain has to work out which information is more important. Is it the tissue damage or is it the temperature? And interestingly, for some reason, the tissue damage information just travels slower than almost every other sensory information that there is. So when you put temperature on top, your brain says, well, what if there's more danger coming because of this new temperature information? So it sends the temperature signal up first, and that makes it more difficult to get the information about the tissue damage to come up to your brain. And what that means is with temperature, you get this little sensory override where you start blocking the painful signals from getting all the way up to your brain. If you've been in pain for a long time, especially if it's a chronic pain complaint that's lasted for longer than 3 months, you could very much get some great benefit from adding this sensory override. If it's a brand new injury, you might not want to stop the pain signal because, again, that's your brain saying, I want you to pay attention. But once we have the pain sensation for long enough, there's a pretty good chance that this has just become a habit. The pain signal is just traveling up to your brain constantly because it's got used to doing so. By adding the temperature or any other type of sensation. So it could be like rubbing, vibration, pressure, anything like that. You can start overriding that stimulus and just having your brain get used to the feeling of no pain because it's paying attention to all the other sensations that are going on. So any kind of pain that's been going on for a long time, especially longer than 3 months, sensation is going to be your friend. It's a really great way to override those pain signals that might be stuck in a kind of habitual pattern. And that might help teach your brain that it's actually okay for it to start easing off on these pain signals.